Now, let's first demonstrate how you would use this on a superficial wound or a wound that doesn't have much depth. And we're going to be using our model here. But also, again, anytime you're doing a dressing change, you're going to have wanted to set up your field with your supplies before you begin. So, and you're going to do that, of course, according to your infection control policies in your facility. But I have my gloves ready. I have wound cleanser. I have my 3M Cavalon no sting barrier film that I'm going to apply to the peri-wound skin for protection. And then I have my dressing size selected based on my wound assessment and open and ready. So for the purposes of our demonstration today, we're not going to demonstrate cleansing the wound, and but I do want to show you just how you would apply the Cavalon no sting barrier film to the wound edges for peri-wound protection. So after you've cleansed the wound and you've dried the surrounding skin, you could either take the 1 milliliter wand applicator and apply it to that surrounding skin and let that dry. You could also use the spray version of the product, and there's also a 1 milliliter wipe. And that's going to help protect that surrounding skin from any excessive moisture that surrounding skin might be exposed to. Okay, let's move those materials out of the way so I can show you the Tegaderm Alginate AG dressing. Now there's two ways you can apply it to a wound that doesn't have a lot of depth. You can either take a wound that's fairly close in size, place it into the wound, and just fold in the edges. Because again, you don't want more overlap than about 1/8 of an inch, all right? So you just kind of fold it in. My model's slipping a little bit here. Fold it in to the edges, and then you would cover this with your cover dressing. And we're going to be talking about cover dressings in just a moment, right? So that's one method. But I generally prefer, based on the size of my wound, to actually cut the dressing and prepare the dressing so I get a little bit more accuracy in the size. So what I've done is, based on my wound measurements, I've gone ahead and cut that dressing, and you can see there's hardly any overlap, a little bit of overlap around that wound, but no more than 1/8 of an inch. So at this point in time, I can go ahead then and put my cover dressing over the top and be confident that as that drainage is absorbed into the alginate dressing, that's going to swell a little bit, shrink down into the wound, and not really threaten those wound edges. But I know also I have my Cavalon no sting barrier film applied, so that skin is very well protected. Okay, now I'm going to just remove that for a second so it doesn't fall out, and then we're going to go ahead and show how to apply the rope dressing into a deeper wound. Let's go ahead and fill the deeper wound on our model now, and we're going to use the rope, as I mentioned. And of course, when you're filling a wound, you can either do this with gloved fingers, or you can use a sterile cotton tip applicator. And you've of course have rinsed your wound, you've irrigated your wound, and then you've also applied a protective barrier film, the Cavalon no sting barrier film, to your surrounding skin. Now, this version of the dressing is also very useful if you have a tunnel or a tract that you need to fill or gently pack. So now you're all ready to go with your wound filler. So just taking your gloved finger, just gently laying the rope in the wound, tucking it into any undermined space, and just layering it back and forth, okay, until you filled the entire wound. All right, and again, you want to fill the wound to the surface, making sure you filled the entire cavity. For this wound, actually, I would probably take another piece of rope and just use a portion of that rope to fill the remaining part of this wound. Again, you want to fill it to the surface with only no more than about 1/8 of an inch overlap around the edges. Right? So that shows you how you would fill using the rope dressing, and I'm just going to take that out now because I also want to show you another technique. If you don't happen to carry the rope in your facility and you instead just carry the pad version, you can also use the pad version to fluff into a wound. And in this case, you wouldn't cut the dressing, but you would just take the Alginate AG, and you would gently tuck and fold the dressing down into the cavity. Not, never stuffing forcefully, always very gently tucking and folding to get the dressing into the wound and completely filling the wound. And this is actually, with the 4x5 dressing, a very nice fit for this size wound. And then at that point, you can apply your cover dressing. And that may be, for more moderate drainage, you may be able to use just a simple composite dressing, such as a Metapore Plus pad. Again, in this area of the body, a lot of times a barrier dressing is a very good choice. A lot of times these patients are also incontinent, so you may need to use the Metapore Plus pad dressing. But if you're needing to absorb larger amounts of drainage, say this wound has a large amount or a copious amount of drainage, then a foam dressing is a much better choice, and you have the option of the 3M foam adhesive dressing. Again, that has a Tegaderm covering, so it provides barrier protection from urine and stool. Or in some situations, you may decide to use the non-adhesive version, which once it's applied would need, of course, to be secured with tape. But I'm just going to go ahead and show you how it would look if we apply our foam adhesive dressing over this wound and pressing that down into place. Okay, and then removing the spoke delivery pieces. And you can see what a very nice finished result. And now that wound is not only filled, has an absorbent antimicrobial wound filler in it, but also has a cover dressing that provides a very nice barrier for it.